Well, it is our health chat. It's Tuesdays, and I love the fact that every Tuesday we get informed with different health talks. And today we're talking about ovarian cysts. And here to tell us more about it, we've got very special guest obstetrician and gynaecologist, Dr. Lindy Murray in the house, as well as multimedia health specialist, Dr. Darren Green.
Good morning.
Welcome, welcome, welcome.
Great to have both
so
of
good
you
to
in
have
company.
you here.
Yeah,
so
thanks.
we're talking ovarian cysts this morning. What exactly is a cyst?
Well, I think strictly speaking, a cyst is really just a fluid collection on the ovary. But in normal conversation, when we talk about ovarian cysts, we really are talking quite broadly and usually about any sort of growth or mass or fluid collection that may be on the ovary.
Yeah.
Oh, okay.
So then, given that it would appear that there are different types of cysts that one could find in this spectrum,
Yes.
what are the different types?
So I think, the typical ovarian cyst is a simple fluid-filled collection of the ovary that obviously can, in some cases, be a little bit more complex, sort of maybe solid areas, multiple sort of cysts on an ovary. And then you could have cysts which have different sort of causes and may represent more blood on an ovary, blood collection, something that's inflammatory or infection-related. And then in rarer cases can be actual growths, which could be benign or malignant, so cancerous growths.
What exactly causes ovarian cysts? Is it diet? What's the situation?
I think it's fairly important to remember that the way the ovary works is that the ovary produces, well, it contains eggs, and every month we ovulate.
Of course, yeah.
And those eggs grow in little fluid-filled sacs called follicles. So the ovary is actually in its normal functioning, producing little fluid-filled collections, which are normal. So within that process, it happens quite easily and often that within that function you can get a cyst formation, which then sort of becomes a bit abnormal, but is fairly common. And so a lot of the cysts we see are simply functional cysts, and they represent functioning of the ovary, or sort of a little deviation of the pathway, but part of that functioning. And
which means often that they often get to resolve spontaneously. Because a lot of people fear so much when they hear the word cyst. They think that it's necessarily a neoplasm or a mass or a tumor. So in this case, obviously, a functional cyst being a normal follicle that's filled with fluid and so forth. Then you get different variations of that as to when the ovum or the egg is actually expelled or not. And then you get obviously different phases of that process where the cyst could form in different parts of the ovary, either outside it or inside it, etc. But from emergency side, the size of the cyst is very important in terms of when you present, because often people don't have any symptoms initially.
So how does one know that now you need professional attention?
So maybe we'll differentiate between emergency and then private practice as well. So I think in the emergency room, we find people come in when the cyst is really big, and it can do one of a few things. It can either obstruct the surrounding structures due to its size ranging from 1 centimeter all the way through to 10 centimeters, where it obstructs the bowel, for example, or presses on the adjacent structures. It can also then obviously rupture into the abdomen, and free fluid can then irritate the inner lining called the peritoneum of the fluid of the abdomen and cause abdominal pain. So in the emergency setting, people come in with nausea and vomiting if there's torsion of the cyst, in other words turning where the blood supply is cut off, or they present with nausea and vomiting and low abdominal pain. In private practice, I think that could be a little bit different.
Absolutely. So we may pick up cysts completely incidentally as part of a general gynae exam, cysts that the patient was completely unaware were there. Otherwise, women tend to complain of discomfort. They might notice sort of a new onset pain. Pain during sex sometimes is a symptom of the cyst.
And the cycles,
So cysts are unlikely to be a cause of an abnormal menstrual cycle in
that's
general.
What I was going to ask. I was like, we naturally have menstrual pain, so this is like taking it to that next level, and it's ongoing.
So with menstrual pain, it's actually quite a good point to bring up. Firstly, a lot of women don't realize that it's completely common. I mean, it's completely normal, and it's common to have pain in your mid-cycle, so at ovulation. So I think a lot of women feel pain mid-cycle and assume I have a cyst, and that's usually not the case at all. That's just pure normal ovarian function. And it's usually felt on one side, and it can be pretty uncomfortable. It lasts a day or two, tends to go away. What I was referring to with the menstrual cycle is a woman who's known or struggles with an abnormal period. That's unlikely to be a cyst. But a cyst can cause a temporary change in the cycle. So you have one or two cycles which sort of don't tend to follow the pattern.
Yes.
Perhaps there's a cyst that's producing a little bit of hormones and throwing everything out.
Okay.
All right. Well, our Medical Tuesday topic today focuses on ovarian cysts and the health around that. So please do engage with us on our social media platforms with your questions or your comments. We'd love to address them and give them to the doctors to answer, which we will do very shortly. Stay tuned.
It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast show. We're live, large and in charge on this Tuesday morning. Our health topic focus this morning, ovarian cysts. And with us, we have Dr. Lindy Murray and Dr. Darren Green here to help us understand the topic a little bit more. And of course, we're looking forward to getting your comments and your questions on Expresso Morning Show, SABC3. That's our Facebook page. We were talking about the causes of ovarian cysts. And we said that it can occur very naturally within the cycle of ovulation, what happens in the ovaries, but there was another cause that you were highlighting during the ad break for us.
I don't know if you want to say something about
polycystic ovarian disease, maybe just 2 lines on that.
Yeah.
Polycystic ovarian disease is a disease, or a disorder rather, that's an endocrine disorder. In other words, it's driven by hormones.
Okay.
Specifically, it's the most common endocrine disorder in women, and it's also the #1 cause of infertility in women. And it's the tendency, obviously, to develop multiple cysts in the ovary.
Yeah.
By no means is that the most common cause of ovarian cysts. That's why we're just saying a little bit about that.
Yeah.
But certainly that presents typically with someone having increased male hormones and androgens, for example, so hirsutism, hair in inappropriate places in ladies, as well as obviously a disrupted menstrual cycle, and sometimes amenorrhea, where they don't even have menstrual cycles because of the multiple cysts that are present in the ovary. But that's just worth a mention,
And I think why it's important to mention it is because of the name. And cysts, people assume that there's one big cyst and it can be managed and the condition goes away. I think the name is misleading. As Darren said, it's a hormone condition. It has a certain appearance on ultrasound, but I don't think it should be confused with a growth on the ovary which needs specific management.
Dr. Darren, you mentioned infertility as one of the things that it could cause. What about cancerous? Can ovarian cysts be cancerous?
Yes, so the majority of cysts that we've mentioned are functional cysts and follicular cysts, and what they call corpus luteum cysts. But there are a group that are called neoplastic cysts that have abnormal cell types in them and have the ability to develop into cancerous kinds of cells. And there are a wide variety on histology that we classify that are cancerous, yes.
Yeah. Earlier on, Dr. Murray, you mentioned that just through a general health checkup, one could detect the development of a cyst. But generally, how are ovarian cysts diagnosed?
So generally, they're diagnosed on ultrasound is the most common imaging modality that we use. And you would only probably use different types of imaging like MRI if there was something that was complicated or not as clear. But most of the time, we would do a simple ultrasound. It's done in your gynae's rooms, and they'd be able to see then and there if there's a cyst or not. And they'd also be able to tell quite a bit about that cyst simply from how it looks on the ultrasound.
Wow. Is there any way that one can... Yeah, you wanted to say?
No, I was just saying that detail on the MRI can often help us decide whether you need to go and look for irregularities or irregular surface areas pointing towards a more neoplastic cancerous cyst or not. If it's a simple cyst versus a complicated cyst.
I want to talk treatment. Is there any treatment available for ovarian cysts?
Well, I think it depends very much on what the cyst is. I think that cysts, it's a very broad term. So in general terms, in a functional cyst, a simple cyst, most doctors in a younger woman, so a woman before menopause, we make quite a big distinction with these sort of things before and after menopause. After menopause, anything on the ovary, even if it looks very sort of benign and simple, we would tend to take more seriously. But in a younger woman with a simple cyst, not too many symptoms, we would simply watch it. So most gynaes would recommend rescanning in sort of 6 to 8 weeks, and we see what the cyst does. The cysts that we would want to treat are those which either are very symptomatic, so really causing a lot of pain and affecting the person's quality of life. Cysts that are not going away on their own, maybe getting bigger. In the emergency setting, as Darren said, any cyst that presents with more emergency type symptoms suggesting it's complicated. or any cyst that either has the appearance of something that might be cancerous or in a patient who's at higher risk of cancer. Then we'd want to remove that cyst, not just for treatment, but actually to be able to send that cyst away and let somebody have a look at it and go, is there any cancer in it? Do we need to look further?
Yeah. All right. So much for us to learn and understand and unpack with regards to our health topic this morning. Ovarian cyst is what it is. Please do engage with us on our social media platforms, Expresso Morning Show, SABC3. That's where you can find us on Facebook. Let loose with your questions and your comments. We'd love to read them and hand them over to the doctors to handle for you.
It's my feel-good breakfast show.
All right, we're back again with Dr. Murray and Dr. Green, focusing on ovarian cysts as our health topic for this Tuesday morning. And we've loved, of course, hearing from you as well on our social media platforms, Expresso Morning Show, SABC3. Here's what you had to say. Duduzile Mtsweni said, I was diagnosed with polycystic ovarian syndrome 11 years ago. I'm 33 now and don't have any babies. Do you think I'll be able to conceive one day, given that I have abnormal menstrual cycle? Is there anything that I can take to boost my first fertility?
So I think that's what you were saying, is polycystic ovarian syndrome is so common. In fact, I mean, it really sort of warrants a discussion all on its own on another day. But I think the message for Duduzile is that two things. Firstly, lifestyle, especially with polycystic ovarian syndrome, because it's hormonal dependent. It's got quite a close link to general health, to weight, to things like diabetes and how your body manages sugar. So all of that has to be carefully looked at. Get to a healthy weight, some exercise, watch the diet. And then she really, really would need to see a gynae to help with, usually what's needed is ovulation induction.
Oh, wow.
To actually, that's usually pills, tablets in the menstrual cycle to actually help her to ovulate. Because the main problem with polycystic ovarian syndrome is that you don't ovulate. So the eggs are there, but they don't really do very much. So that's what would need to happen.
We've got another comment from Hayley Prince, who says, good morning, Expresso family and doctors. Good morning, Hayley. I always had terrible menstrual cramps. In 2016, I was diagnosed with dermoid tumors that had hair growing in them already. I had a laparotomy a week later, and with the operation was diagnosed with stage 4 endometriosis, which is a disease not really understood.
That's a tough one. I think endometriosis is often associated with really, really painful menses, which we call dysmenorrhea. And in this case, obviously, you have what are called the presence of endometrial tissue outside the uterus. So it can grow on bowel, it can grow on the ovaries, it can grow inside the abdominal wall. But the problem with that, with those structures, are they responsive to hormones. So as you go through the normal menstrual cycle, that tissue then also can swell and obviously cause secondary inflammatory effects in the bowel as well, and the abdomen. So the pain is a significant component of that. And obviously endometriosis is quite complex to treat. There are hormonal treatments, there's surgical laparoscopic procedures where they actually go and scrape off some of those lesions if necessary over time. I don't know if there's anything else that you'd like to add.
I think that also just from that question is that there were two issues there. So we spoke about it briefly on the break. I mean, there's also, when we speak about ovarian cysts being cancerous or non-cancerous, one of the non-cancerous growths that we sometimes see are dermoid cysts. And dermoid cysts are sort of quite interesting growths on the ovary. They're things that generally are there from when you were born. And we sometimes see all sorts of funny things in them, like hair tissue and a whole variety of different tissues in them. And we normally remove those because they can cause problems.
Let's take a look at another comment from Lebogang Magashula saying, morning fam, morning to you, Lebogang. What I want to know is that, is it normal to skip your periods even if you're not sexually active? Because most of the skipping of your monthly periods, it's only if you're pregnant or getting menopause. So let's quickly break that down in relation to the topic that we're talking about. If you do happen to skip your menstrual cycle, could there be an indication of the development of some kind of cyst?
Well, I think that, your menstrual cycle is hormonally managed. It basically is a very finely tuned hormonal sort of cycle.
Yeah.
So anything that might cause those hormones to not sort of function as they should is going to cause an alteration in the menstrual cycle, which could lead to an irregularity or even skipping completely. So one of the things we mentioned was polycystic ovarian syndrome. Many times we don't know why periods are irregular, but they can be, not necessarily cyst-related at all. Probably best then to chat to a doctor to see what the specific cause is in that case.
Yeah.
Wow,
Even
quite
something as simple as being really, really thin and having an eating disorder can
Or
lead to,
stressed.
and
Stress,
stress
change in
can
life
alter
or-
the cycle.
Yeah.
So people need to understand that those influences are quite significant too.
So we were talking about the various cysts that we have, because I wanted to talk about, is it possible to prevent them? Is that something that we can look at? And also, what is the long-term outlook for someone who has them or who has had ovarian cysts?
So I think that, again, because there's so many different causes and that to prevent them, to be able to say how we prevent them is probably quite difficult. We would only aim at trying to prevent cysts in women who tend to get recurrent cysts.
Okay.
And normally how that's done is by putting a woman on the pill, the normal contraceptive pill, because what that does is that sort of overrides their own hormonal menstrual cycle and may tend to stop those functional cysts from recurring.
Okay.
But in most of the time, we don't really aim to prevent them as much.
Okay.
Yeah, and treatment, just to kind of go a little bit deeper into that one more time, about how treatment is administered once the diagnosis has been made.
So if we do need to treat cysts, we treat them surgically.
Okay.
And luckily, most of the time, we can do what we call minimally invasive or laparoscopic surgery. So that's a full surgery under anesthetic, but it's done through keyhole sort of entry. So very little sort of incisions on the skin, and we work sort of under camera guidance, and we can actually do quite a lot like that with minimal pain, minimal scarring, minimal downtime. And then that would include either draining a cyst, removing a cyst, or if there's a suspicion of cancer, or if it's an older woman, we often remove the ovary and the cyst together.
Sure. Wow. Wow, that was our talk on ovarian cysts. Thank you. Very, very informative. And I know that our Expresso family appreciated it as much because, I mean, we had so many wonderful questions on our Facebook page. So thank you so much, Dr. Lindy, for being here. And, of course, Dr. Darren Green.
Thank you.
And making our Medical Tuesdays always, you know, so it's always got gravitas. Really appreciate it.